Welcome to Strategies to Prevent Harmful Sexual Behaviours, a webinar by Links Training and Support. I'd like to start by acknowledging the original custodians of the land on which I'm recording this webinar and the lands on which you're watching. I'd also like to pay my respects to elders past, present and emerging. During this webinar, I'll be talking about some difficult topics and you might experience some strong feelings. If you're finding it difficult to stay present, you could try centering yourself using a fidget toy or doodling, taking a few slow breaths, pausing the webinar, standing or moving around as you watch, or having a drink or something to eat. For those of you who have not seen our previous webinars, or those who just like a refresher, harmful sexual behaviours are those displayed by kids under 18 years. These behaviours are outside what is culturally accepted as developmentally typical. They may be compulsive, obsessive, secretive, aggressive, coercive, or violent. They might involve a substantial difference in the age or developmental ability of those involved, and they can be harmful to those displaying the behaviours or to others. You may have heard a variety of terms used to describe childhood sexual behaviours, including problematic and abusive. I'll use the term harmful sexual behaviours throughout this webinar, as it's considered the most appropriate terminology to cover a range of behaviours. I'll also use the term kids to represent all children and young people in out-of-home care. In this webinar, I'll introduce strategies to prevent harmful sexual behaviours developing in kids who've experienced trauma. Effective support networks play a vital role in many of these strategies, so let's look at these networks now. Kids in out-of-home care often have numerous support needs related to trauma. If these needs are unmet, they may contribute to the development of harmful sexual behaviours. Strong support networks help to meet kids' needs in a holistic way. These networks, which can include trusted adults like carers, caseworkers and therapists, are referred to as child support teams. The idea is that these teams share information and insights about kids to identify support needs and to address them. Child support teams can also ensure members have access to appropriate resources and support. Now let's explore the link between trauma and harmful sexual behaviours. The majority of kids in out-of-home care have experienced multiple traumas from a young age, resulting in complex trauma. Research indicates the early life experiences of kids in out-of-home care, such as physical abuse, neglect, sexual abuse, and domestic violence, makes them vulnerable to developing harmful sexual behaviours. Intervening early to address trauma has been shown to build protective factors which can prevent the development of behaviours of concern. This can be achieved through building skills and support. We'll take a close look at these factors now. Skill building increases protective factors because the more skills kids have, the better their potential outcomes are. Skill building is a significant prevention strategy and should occur continually across childhood and adolescence. By increasing protective factors, you can reduce the likelihood of harmful sexual behaviours occurring. Kids in out-of-home care often benefit from skill building in key areas like emotional regulation, decision-making, and engagement in activities. They can also benefit from the implementation of behaviour and therapeutic supports and the development of appropriate sexual knowledge. Let's explore these protective factors in more detail. Many kids in out-of-home care have not had the opportunity to develop healthy ways of expressing feelings and emotions. As a result, they may feel overwhelmed or have trouble experiencing a wide range of emotions. Harmful sexual behaviours can arise when kids are trying to avoid strong feelings, experience positive emotions, or manage how they feel. For this reason, supporting kids to build emotional regulation skills is vital. Emotional regulation is the ability to identify how they're feeling and manage their emotions. Adults can help kids increase their emotional regulation by being a calming presence and supporting the identification, naming, and describing of emotions. It's also important to practice skills and activities that help to regulate a kid's emotions, such as relaxation and calming skills, breathing techniques, and mindfulness. Child support teams should work together to identify emotional regulation activities specific to individual kids. Developing personalised strategies to promote behavioural change is another recommended strategy and is sometimes called positive behaviour support. There are a range of positive behaviour supports that can provide safe, predictable and consistent environments for kids in out-of-home care. Kids who have experienced trauma need clear, predictable boundaries, rules and routines to feel safe and to know what is expected of them. During times of trauma, power and control is often taken away from kids. They learn that being in control helps to keep them safe. A loss of power and control can also be a trigger for harmful sexual behaviours. By offering kids choice, providing consistency and supporting them to make decisions, you can increase their sense of safety. Having clear behaviour strategies in place also helps to manage the home environment, safety and any behaviours. It's important for the child support team to develop appropriate behaviour support strategies and boundaries together. This ensures that they are more effective. Seeking support from a psychologist or behaviour support expert will help to identify the most appropriate strategies. Kids in out-of-home care have not always had the opportunity to build connections or social skills. This places them at increased risk of displaying harmful sexual behaviour. All kids in out-of-home care can benefit from building social skills and connections. These skills also form key protective factors which can reduce their risk of developing behaviours of concern. You can help kids to identify activities that will build their skills, self-esteem and connectedness. These activities should correspond with a kid's interests and strengths and might include sporting, cultural, religious, volunteer or artistic groups. Be prepared for kids to try several different activities before finding the one that they really enjoy. The kids you are supporting may have a range of behavioural and mental health needs which continue despite being in a loving, stable placement. Kids in out-of-home care have usually experienced multiple traumas at a young age, which can increase their support needs. To reduce their impact, it's important to address these traumas through the consistent support of caring adults, skill building and therapy. Childhood trauma is an identified risk factor in the development of harmful sexual behaviours. Addressing trauma will help to reduce this risk. You may be wondering when kids benefit from support. The factors that indicate support is required include challenging behaviours, withdrawal or isolation, issues with relationships, disability or special needs, self-harming behaviours, or trouble learning at school. If needs are identified, the child support team should work together to identify appropriate supports for both kids and their carers. But let's look at skill building specific to sexual knowledge now. Knowing about sex and relationships is key to prevention of harmful sexual behaviours. Sexual education should start in infancy. These conversations most easily occur during bath times and toileting. Kids will naturally have questions about sex and relationships, often starting from early childhood. It's important to respond accurately and factually with information that suits their age and development. Effective sexual education covers a number of areas, including sex, puberty, sexuality, and relationships. You'll find a range of online resources listed on our website to help you. Sexual education should ideally occur prior to 11 years of age or before kids reach puberty. From then on, there should be ongoing conversations to ensure they have appropriate knowledge and behaviours. These conversations also ensure kids feel comfortable to discuss these issues as they arise. Comprehensive and accurate information around sex helps to prevent harmful sexual behaviours. If kids are not provided with this knowledge in an accurate or a timely way, they're likely to seek information from friends, the internet, or pornography. They might also base their sexual behaviours on inaccurate knowledge, placing them at greater risk of concerning behaviours. But not everyone is sure about the information to provide or how to approach these conversations. It's common to feel uncomfortable providing sexual education. Child support teams should work together to ensure all kids in out-of-home care are provided with accurate and appropriate information. Thank you for watching this webinar. You'll find further webinars and resources on harmful sexual behaviours on the Links Training and Support website. Our website also has a range of resources on trauma-informed care, which is a key prevention strategy for harmful sexual behaviours. Thank you.